Frequently asked questions for the CHED-DOH JMC number 2021-004 or the guidelines on the implementation of limited face-to-face classes for all programs of higher education institutions in areas under alert level system for COVID-19 response. Question number 1. Is the resumption of limited face-to-face classes mandatory? The answer is no. As stated in Section 4A of CHED-DOH JMC number 2021-004, limited face-to-face classes are not mandatory. HEIs are given the discretion to conduct limited face-to-face classes or to continue the implementation of flexible learning modalities. If the HEI opts for flexible learning modalities, they shall be governed by the provisions under CHED Memorandum Order Number 4 Series of 2020 or the guidelines on the implementation of flexible learning. Question number 2. Do we need to secure a permit from CHED to conduct limited face-to-face classes? The answer is no. The HEI must comply with the provisions of CHED-DOH JMC number 2021-004 and do a self-assessment if they can comply. If based on the self-assessment, the HEI is compliant, the HEI may conduct limited face-to-face classes. HEIs should, however, notify the CHED through the CHED-DOH by submitting an accomplished self-assessment checklist and notarized affidavit of undertaking. Question number 3. Do we need additional permits to continue the conduct of online classes? The answer is no. The conduct of flexible learning modalities, which includes online classes, shall continue to be governed by CHED Memorandum Order Number 4, Series of 2020, or the guidelines on the implementation of flexible learning. Question number 4. Are schools required to put up plastic barriers inside the classrooms? The answer is not required. HEIs shall develop and strictly implement institutional policies and actions that revolve around and conform with the minimum public health standards mandated by the IATF and DOH. HEIs are recommended to utilize visual cues and floor markers as needed. Question number 5. Are students required to wear face shields? The answer is wearing a face shield is optional in areas under Alert Level System 1 to 3 per IATF Resolution Number 149. As administrative prerogative, HEIs may add stringent health measures if deemed fit. However, this may be mandatory, subject to new directives of the IATF or LGUs. Question number 6. Are students required to have PhilHealth? Can they get insurance coverage from other HMOs? The answer is yes. As stated in Section 4H of CHED-DOH JMC number 2021-004, HEI shall ensure that students will participate in limited face-to-face classes under this JMC and subsequent guidelines to be issued by CHED are registered with PhilHealth or with equivalent medical insurance that covers medical expenses related to COVID-19. Students may be direct or indirect contributor, dependents of direct contributor for PhilHealth. Question number 7. Is the school liable if a student contracts COVID-19, assuming from attending face-to-face classes? The answer is in case of a violation of Article 4H of CHED-DOH JMC number 2021-004 on the medical insurance, and it is shown that the student gets infected by COVID-19 brought about by their participation in the limited face-to-face classes, the HEI shall facilitate the necessary medical treatment or procedures for the affected student. Question number 8. Is there an age requirement for students who will participate in the limited face-to-face classes? The answer is no. There is no age requirement to participate in the limited face-to-face classes. Question number 9. Can unvaccinated students participate in the limited face-to-face classes? The answer is no. Per Section 2 of CHED-DOH JMC number 2021-004, only fully vaccinated students may participate in the limited face-to-face classes. Please take note that there is no disruption in education since unvaccinated students are governed by flexible learning. Question number 10. Are graduate programs included in the limited face-to-face classes? The answer is yes. All programs, certificate, diploma, undergraduate, graduate, across all disciplines and year levels are allowed to participate in the conduct of limited face-to-face classes in areas under Alert Levels 1, 2, and 3 of the Alert Level System for COVID-19 response. Question number 11. Do HEIs need to submit letter of intent to the concerned CHED-DOH? The answer is no. Only the accomplished self-assessment checklist and the notarized affidavit of undertaking are required to be submitted to the concerned CHED-DOH. Question number 12. Will the CHED-DOH inspect the facilities of HEIs and issue approval before they can reopen? The answer is no. However, the CHED-DOH may issue safety seals for applying HEIs. CHED will issue separate guidelines for the Safety Seal Certification Program for HEIs. The CHED will also conduct random and on-site inspections of HEIs conducting limited face-to-face classes to check for the compliance with the provisions of CHED-DOH JMC number 2021-004. Question number 13. Can CHED suspend the conduct of limited face-to-face classes of HEIs? The answer is yes. Section 9 of CHED-DOH GMC number 2021-004 states that any violation of these guidelines shall be a ground for suspension of the conduct of limited face-to-face classes without prejudice to such other sanctions as may be imposed. If public interest demands, such as but not limited to national security, public safety, and public health, CHED may, without notice, order an HEI for a preventive and immediate suspension of the conduct of its limited face-to-face classes. Question number 14. Will the limited face-to-face classes be automatically suspended when a student tested positive for COVID-19? The answer is as stated in Section 6 of CHED-DOH JMC number 2021-004, the implementation of limited face-to-face classes shall be preventively suspended then reopened based on the following scenarios. Question number 15. Can we conduct face-to-face graduation ceremonies? The answer is yes, subject to the approval of your local government unit. Section 4G of CHED-DOH JMC number 2021-004 states that in-person and group-based co-curricular and extracurricular activities such as sports events, musical events, competitions, in-person graduation rites, ceremonies, among others, may be allowed subject to the approval of the concerned LGU. Compliance with the applicable health protocols and the conditions laid down under IATF resolutions and its succeeding issuances. Question number 16. Can students conduct face-to-face internships? The answer is yes, subject to the approval of your local government unit. Section 4F of CHED-DOH JMC number 2021-004 states that off-campus activities for the completion of course requirements, example, National Service Training Program, internship, practicum, training, fieldwork are allowed subject to the approval of the LGU. In line with this, LGU shall proactively coordinate with the HEIs to ensure ease of doing business and effective government service delivery.
Good morning, everyone. As we start our event today, the public orientation on the Commission on Higher Education and Department of Health Joint Memorandum Circular number 2021-004 guidelines on the implementation of limited face-to-face classes for all programs of higher education institutions or HEIs in areas under alert level system for COVID-19 response. Let us ask for the grace of the Lord. Let us remember that we are always in His presence.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Ladies and gentlemen, the Philippine National Anthem.
Kayang mag-ibig, telas ng sinakanan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, sa nagagang tutok sa simoy at sa langit kong pagaw, ay hinatang tula, kawin sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na naghihingi. Ang bituin at araw niya kailan pa may di magtitingin. Lumalang araw ng walhagin pagsinta, buhay langit sa piling mo. Ang inigaya ng pagkay mga amin, ang mamatay ng dahil sa'yo. Ay tumugon, mapagpagod, mapaghamon, layunin sa mataas na edukasyo'y sulong. Ito ay panat at pananagutan sa bayan, komisyon sa lalong mataas na edukasyon. Tinitiyak kalidad at programa'y abot ng lahat. Ng edukasyong institusyon ngayon'y laganap. Sentrong kagalingan, kamulatan at pangarap ng bawat Filipinong may matayong labukas. Komisyon sa lalong mataas na edukasyon. Sa mundo ay hiyaw, mataas na edukasyon. Ang Filipino'y mahusay, tatak, CHED, itanghal, itanghal, Filipino mahusay, CHED, mabuhay. Ngayon ay itindig ang lago ng intelektual, lumikha ng mabuti at maunlad na mundo. Panganang kasaysayan, kultura'y tanghal dito, angat Filipino mahusay may dangal.
All right, good morning, everyone. Good morning, everyone. Once again, welcome to our event today, the Public Orientation on the Commission on Higher Education, or CHED, and Department of Health, or DOH, Joint Memorandum Circular number 2021-004, Guidelines on the Implementation of Limited Face-to-Face Classes for all programs of higher education institutions in areas under Alert Level System for COVID-19 response. I am Rafi Nesho of the CHED, Office of the Executive Director, and I will be your Master of Ceremonies today. Before we proceed to the main part of our program, may we have some reminders? So, one, please identify yourself properly in your display screens. Use an example of which is organization position name. So an example is displayed on the screen, CHED-1-ES2 Juana de la Cruz. Next, put your microphones on mute until it is your time to speak. Number three, the session is being recorded, so some or all of it may be used in CHED's future materials. And last but not the least, if you have slow or unreliable internet connection, you may keep your video off to minimize lag on your end. Okay, that's again a reminder. So change your name, only mute if it's your time to speak. The session is being recorded, and if you have slow internet, you may turn off your video. Okay, next, the outline for the public orientation today. First, we had the opening activities. So while we were being admitted to the Zoom room and to the while tuning in on the Facebook Live, we were presented with the frequently asked questions for the advanced reference of everyone. And we had prayer, the singing of the Philippine national anthem, as well as the CHED hymn. And now, the reminders in outline. Okay, so before we call in our speakers today, let's acknowledge first our participants. May we see our participants from the National Capital Region. Kaway po tayo sa camera sa ating higher education institutions, officials and staff. Magandang umaga po sa inyong lahat, as well as of course our CHED officials and staff from the CHED National Capital Region. Good morning po. And of course, we have our participants from the Region 1. Hello po. Good morning. Kaway po tayo para makita po tayo ng ating mga kasama ngayon sa Zoom room. As well as, of course, our friends from the CHED Regional Office 1. Okay, good po. Next, we have our higher education institutions from Region 2. Good morning po. Good morning po sa ating lahat. Maraming salamat po sa pagdalo. And of course, our colleagues from CHED Regional Office 2. Good morning. Let's go to Central Luzon. Good morning to our higher education institutions in Central Luzon, Region 3. Thank you for attending this morning's public orientation on JMC number 4. Okay. Siyempre sa ating mga kaibigan sa Cordillera Administrative Region, good morning po sa inyong lahat. I see some of our HEIs and CHED office personnel raising their hands. Para doon sa hindi makakaway sa video, pwede po tayo mag-raise na hand to be acknowledged. Hello po, good morning. Next, we have our schools from the Region 4. Good morning po sa ating lahat. Good morning. Pumunta naman tayo sa ating higher education institutions in Mimaropa. Kasama po tayo ngayon ni Attorney Joselito Aliswag, our Regional Director for Mimaropa. Good morning po. Okay. Punta naman po tayo sa Bicol. Maray na aga sa Indogabos, sa mga taga Bicol po. And we are joined by our Regional Director, Freddy T. Bernal. Sir, good morning po, RD. together with our schools in the Bicol region or Region 5, and of course our friends from the CHED Regional Office 5. Okay. Punta naman po tayo sa Visayas. Okay, maayong Alda, maayong buntag, maayong buntag sa ating mga kaibigan sa Visayas, Region 6. Good morning po sa inyong lahat. Together with our officials and staff from Regional Office 6. Next, we have our friends from Cebu, Regional Office 7. Good morning po sa inyong lahat. And Region 8, good morning po sa ating schools from Region 8. And of course, our officials and staff from CHED Regional Office 8. Next, we have, we go to Mindanao. Nasaan po ang ating mga schools from Region 9? Sa Zamboanga Peninsula. Good morning po. And of course, our friends from the CHED Regional Office 9. Okay. Next, of course, we go to Northern Mindanao, CHED Regional Office 10. Good morning po. Now we go to Regional Office 11 together with our higher education institutions in Region 11. Good morning po sa ating lahat. And our higher education institutions in Regional Office 12 together with our officials and staff from CHED Regional Office 12. Good morning po. Of course, kasama po tayo ngayon ng ating Regional Office Director, Dr. Nida Kalagi from CHED Regional Office Caraga together with the official staff of CHED Regional Office Caraga. Good morning po. And of course, our schools from from Caraga. Okay. How about our from our CHED Central Office officials and staff? Thank you for attending our event this morning. Maraming salamat po. All those in the Zoom as well as in the Facebook Live. Okay, sige. So I hope I was able to call everyone. Thank you very much for attending. Later on, we'll be meeting more of our colleagues in the higher education sector, and hopefully this, as we all hope this morning, we'll be able to have our usual productive and enlightening session this morning. So I'm just reading the greetings of our participants in the chat box. Okay. Sige. Okay, good morning po sa ating lahat. Maraming salamat po for attending. And I hope earlier as the frequently asked questions were present, nabigyan na tayo ng advanced natin, clarification. So later on in the open forum, may other questions pa po kayo that were not covered, of course, in the frequently asked questions, or maybe after the presentation of the whole JMC 2021-004. Okay? Sige. So in the meantime, for those participants who have just joined this session, may present again the frequently asked questions video. Okay. Sige. So let's all watch this.
frequently asked questions for the CHED-DOH JMC number 2021-004 or the guidelines on the implementation of limited face-to-face classes for all programs of higher education institutions in areas under alert level system for COVID-19 response. Question number 1. Is the resumption of limited face-to-face classes mandatory? The answer is no. As stated in Section 4A of CHED-DOH JMC number 2021-004, limited face-to-face classes are not mandatory. HEIs are given the discretion to conduct limited face-to-face classes or to continue the implementation of flexible learning modalities. If the HEI opts for flexible learning modalities, they shall be governed by the provisions under CHED Memorandum Order Number 4 Series of 2020 or the guidelines on the implementation of flexible learning. Question number 2. Do we need to secure a permit from CHED to conduct limited face-to-face classes? The answer is no. The HEI must comply with the provisions of CHED-DOH JMC number 2021-004 and do a self-assessment if they can comply. If based on the self-assessment, the HEI is compliant, the HEI may conduct limited face-to-face classes. HEIs should, however, notify the CHED through the CHED-DOH by submitting an accomplished self-assessment checklist and notarized affidavit of undertaking. Question number 3. Do we need additional permits to continue the conduct of online classes? The answer is no. The conduct of flexible learning modalities, which includes online classes, shall continue to be governed by CHED Memorandum Order Number 4, Series of 2020, or the guidelines on the implementation of flexible learning. Question number 4. Are schools required to put up plastic barriers inside the classrooms? The answer is not required. HEIs shall develop and strictly implement institutional policies and actions that revolve around and conform with the minimum public health standards mandated by the IATF and DOH. HEIs are recommended to utilize visual cues and floor markers as needed. Question number 5. Are students required to wear face shields? The answer is wearing a face shield is optional in areas under Alert Level System 1 to 3 per IATF Resolution Number 149. As administrative prerogative, HEIs may add stringent health measures if deemed fit. However, this may be mandatory, subject to new directives of the IATF or LGUs. Question number 6. Are students required to have PhilHealth? Can they get insurance coverage from other HMOs? The answer is yes. As stated in Section 4H of CHED-DOH JMC number 2021-004, HEI shall ensure that students will participate in limited face-to-face classes under this JMC and subsequent guidelines to be issued by CHED are registered with PhilHealth or with equivalent medical insurance that covers medical expenses related to COVID-19. Students may be direct or indirect contributor, dependents of direct contributor for PhilHealth. Question number 7. Is the school liable if a student contracts COVID-19, assuming from attending face-to-face classes? The answer is in case of a violation of Article 4H of CHED-DOH JMC number 2021-004 on the medical insurance, and it is shown that the student gets infected by COVID-19 brought about by their participation in the limited face-to-face classes, the HEI shall facilitate the necessary medical treatment or procedures for the affected student. Question number 8. Is there an age requirement for students who will participate in the limited face-to-face classes? The answer is no. There is no age requirement to participate in the limited face-to-face classes. Question number 9. Can unvaccinated students participate in the limited face-to-face classes? The answer is no. Per Section 2 of CHED-DOH JMC number 2021-004, only fully vaccinated students may participate in the limited face-to-face classes. Please take note that there is no disruption in education since unvaccinated students are governed by flexible learning. Question number 10. Are graduate programs included in the limited face-to-face classes? The answer is yes. All programs, certificate, diploma, undergraduate, graduate, across all disciplines and year levels are allowed to participate in the conduct of limited face-to-face classes in areas under Alert Levels 1, 2, and 3 of the Alert Level System for COVID-19 response. Question number 11. Do HEIs need to submit letter of intent to the concerned CHED-DOH? The answer is no. Only the accomplished self-assessment checklist and the notarized affidavit of undertaking are required to be submitted to the concerned CHED-DOH. Question number 12. Will the CHED-DOH inspect the facilities of HEIs and issue approval before they can reopen? The answer is no. However, the CHED-DOH may issue safety seals for applying HEIs. CHED will issue separate guidelines for the Safety Seal Certification Program for HEIs. The CHED-DOH will also conduct random on-site inspections of HEIs conducting limited face-to-face classes to check for the compliance with the provisions of CHED-DOH JMC number 2021-004. Question number 13. Can CHED suspend the conduct of limited face-to-face classes of HEIs? The answer is yes. Section 9 of CHED-DOH GMC number 2021-004 states that any violation of these guidelines shall be a ground for suspension of the conduct of limited face-to-face classes without prejudice to such other sanctions as may be imposed. If public interest demands, such as but not limited to national security, public safety, and public health, CHED may, without notice, order an HEI for a preventive and immediate suspension of the conduct of its limited face-to-face classes. Question number 14. Will the limited face-to-face classes be automatically suspended when a student tested positive for COVID-19? The answer is as stated in Section 6 of CHED-DOH JMC number 2021-004, the implementation of limited face-to-face classes shall be preventively suspended then reopened based on the following scenarios. Question number 15.
Okay, thank you very much. That was our frequently asked questions for the CHED-DOH GMC 2021-004. So maraming salamat po. So this time around, again, thank you very much for attending our dear higher education institutions all over the country from all our regions, and of course, our officials staff, our regional directors from our CHED regional offices, also with our technical working group members on limited face-to-face. Maraming salamat po for attending. So without further ado, we'll be presenting to you the CHED-DOH JMC 2021-004, or the guidelines on the implementation of limited face-to-face classes for all programs of higher education institutions in areas under alert level system for COVID-19 response. So this will be presented, of course, by one of our very own regional directors, and as well as the members of the Technical Working Group, or TWG, for limited face-to-face classes. We are graced by the presence now. We have Dr. Maria Teresita M. Semana, the officer in charge of the Office of the Director 4 of the CHED Regional Office 3. Good morning, ma'am. Together with Attorney Joselito C. Aliswag, Director 4 of the CHED Mimaropa. Good morning, sir. So with that, we welcome them as they present to us the contents of the CHED-DOH JMC 2021-004. Good morning po, Ma'am Semana, Attorney Lito. Good morning po.
Okay. Isang napakagandang umaga po sa ating lahat mula sa Central Luzon. Binabati ko po ang mga katropa ko sa CHED Regional Office 3. Nakikita ko po sila. Kasama na rin po ang ating mga higher education institutions sa Rehiyon 3. And extended greetings to our Chair, Chair Popoy, to our Executive Director, Attorney Cinderella Filipina Benitez Haro, and our colleagues, the regional directors, technical personnel, as well as our secretariat and the technical working group, at yung kapartner ko, no, si Attorney Joselito Aliswag. Magkatropa po kami sa TWG. So can we move on to the assigned topics for my presentation, Secretariat? Okay, so magandang pagbati rin po sa lahat ng higher education institution sa buong Pilipinas. Sana po tayo po ay nakapag-enjoy ng ating Christmas. And now, pag-usapan po natin yung paghahandaan natin this coming January. So umpisahan ko na po, no? Section 2, the scope and coverage of the CHED-DOH JMC number 2021-004. Kung familiar po kayo doon sa mga naunang bersyon, yung 001, 002, 003, masasabi ko po bilang technical working group, medyo po may pagbabago po. Kaya dapat pong maintindihan natin at maunawaan natin dahil nung mga naunang mga bersyon ay nakatutok lamang doon sa mga programa na ating may approval. But this one po, ang pinaghahandaan natin ay yung talagang limited face-to-face classes na open po sa lahat ng programa. So that is why in Section 2, Scope and Coverage, letter A, Phases and Duration of Implementation, we have to ensure the safe reopening of campuses of HEIs for limited face-to-face classes for all programs with the following phases. So for Phase 1 po, all HEIs in areas under alert levels 1 and 2. And nagkaroon po tayo ng orientation and naumpisahan po ito December 2021 onwards. Pero yung phase 2 po, all HEIs na po ito in areas under alert level 3. Okay, so January 2022 onwards. Next slide, please. So, letter B, higher education institution po. All SUCs, LUCs, and private HEIs, including all their campuses, branches, may conduct limited face-to-face classes, provided that there is no objection from the local government unit. Ayan po, no, naka-highlight po yan. Provided there is no objection from the local government unit where their activities may take place for all programs based on the following conditions. HEIs are located in provinces, highly urbanized cities, and independent component cities under alert level 1, full indoor and outdoor venue capacity. Alert level 2, maximum 50% indoor venue capacity and 70% outdoor venue capacity. Or alert level 3, maximum 30% indoor venue capacity and 50% outdoor venue capacity as placed under said alert level by the IATF. Number 2, HEIs have conducted a self-assessment of their compliance with this JMC, which I would like to emphasize, my dear HEIs, kasi ito po yung kaibahan natin, ano, ng 004 as compared dun sa 001 to 003. Kailangan po mag-conduct kayo ng self-assessment of your compliance with this JMC. Although nakapag-conduct po kayo ng self-assessment ninyo doon sa ibang version, pero po may karagdagang importanteng dokumento na i-explain ko po later. And lastly, number 3, HEIs will comply with this JMC under policies of the IATF, minimum public health standards and COVID-19 related protocols of the DOH and health and safety protocols of their LGUs. So lubhang napaka-importante po ang inyong pakikipag-communicate and coordination with the LGUs. Next slide, please. Letter C, teaching and non-teaching personnel. Only fully vaccinated teaching and non-teaching personnel of HEIs located in areas under alert levels 1, 2, and 3 shall be allowed to join the conduct of limited face-to-face classes. So, ito po, HEI shall advise those who are over 60 years of age with uncontrolled health risks, for example, immunocompromised states and other comorbidities, and or pregnant women intending to join limited face-to-face classes of the risk of contracting COVID-19 and to consider work from home arrangements instead. Now, HEI shall take additional precautionary measures as needed for vulnerable individuals who will participate in the limited face-to-face classes. Ayan po ano. So, only fully vaccinated teaching and non-teaching personnel, and may mga conditions po tayo for consideration po ng mga HEIs natin. Next slide, please. For students, letter D, only fully vaccinated students of HEIs located in areas under alert level 1, 2, and 3 shall be allowed to join limited face-to-face classes. Now, HEI shall advise fully vaccinated students with significant comorbidities themselves or living with individuals with similar conditions to consider flexible learning and take face-to-face classes in succeeding semesters or whenever possible without prejudice to readmission and maximum residency. HEI shall take additional precautionary measures as needed for the vulnerable groups who will participate in the limited classes. Letter E, for the programs and courses. Ito na po. All higher education programs and courses across disciplines and year levels shall be considered for the implementation of limited face-to-face classes in areas under alert level 1, 2, and 3. So malinaw na po yun, ano? All programs and courses. Now, in summary, for the scope and coverage, all SUCs, all LUCs, all private HEIs, including campuses and branches. All higher education programs and courses across disciplines and year levels. Only fully vaccinated tertiary students and only fully vaccinated teaching and non-teaching personnel will be able to participate in the conduct of the limited face-to-face classes. Next slide, please. Now, for the definition of terms, Section 3 of the JMC, hindi ko na po isa-isahin, ano po, in essence of time, but I would like to, please go back to the first slide. Please go back to the first slide on the definition of terms, Secretariat, please. But I want you to also understand all the terms that we will be using for this JMC and the other related JMCs and guidelines of CHED. So we have the definition for the cluster and clustering, the COVID-19 alert level system, which is different from the one that we had, and then granular lockdown, disease surveillance, fully vaccinated individual. Next slide, please. Isolation, limited face-to-face classes under alert level system, minimum public health standards, retrofitting, na familiar na po tayo, quarantine vulnerable individuals. But ito po pag-usapan natin, itong in-emphasize natin na fully vaccinated individuals. Sino ba sila? When we say fully vaccinated individuals, this refers to someone who is at least 2 weeks past having received the second dose of 2-dose vaccine or the first dose of a single-dose vaccine, or someone who received the recommended booster dose at least 2 weeks after. So may kolatilya po, at least 2 weeks after. The vaccine against COVID-19 administered to the individual must be included in the emergency use authorization list or compassionate special permit issued by the Philippine Food and Drug Administration or emergency use listing of the World Health Organization. So yun po yung kolatilya natin, and it's very important that we have to implement it when we check our students and our faculty members and non-teaching personnel. Next slide, please. Okay, on section 4, general guidelines. Letter A, limited face-to-face classes, not mandatory. Ayan, nakita po natin yan sa frequently asked question. But let me kindly enumerate those things that we have to remember. The conduct of limited face-to-face classes is within the discretion of the HEIs. Again, within the discretion of the HEIs. HEIs who prefer not to conduct limited face-to-face classes shall continue to implement flexible learning under CMO number 4 series of 2020. HEIs are, however, encouraged to prepare their facilities and stakeholders for the face-to-face classes. Number 2, students who could not participate in the conduct of limited face-to-face classes shall continue to be governed by CMO number 4 series of 2020. In this case, the HEI shall institute or implement the necessary mechanism so that students who opted to flexible learning shall not be prejudiced. And number 3, all other degree programs and courses subjects not included in the implementation of the limited face-to-face classes shall be delivered through flexible learning. Next slide, please. Letter B on the implementation of flexible learning. When the localities of the HEIs get reclassified to alert levels 4 or 5, limited face-to-face classes shall be automatically suspended. HEIs shall revert to implementing flexible learning. HEIs shall resume offering limited face-to-face classes once the locality is reclassified back to alert level 2 or 3. Next slide, please. Letter C on DOH minimum public health standard. The HEI shall develop and strictly implement institutional policies and actions that revolve around the conform with the following minimum public health standards of the DOH, as provided in detail in DOH Administrative Order number 2021-0043, or the Omnibus Guidelines on the Minimum Public Health Standards for the Safe Reopening of Institutions. So kasama po tayo sa higher education dyan. So letter D, minimum physical distance in HEIs, it's still 1.5 meters. Authorized HEIs shall strictly implement physical distancing protocols for their students, faculty, and staff while inside the school premises. The physical distance for students undergoing limited face-to-face classes shall be 1.5 meters without prejudice to HEIs increasing the prescribed physical distance. Next slide, please. Letter E, physical education classes. Contact and non-contact sports activities for PE classes shall be allowed in areas under Alert Level 2. Only non-contact sports activities for PE classes shall be allowed in areas under Alert Level 3. In the event of new IATF resolutions on the conduct of contact and non-contact sports, such is deemed part of the issuance and should be observed. Letter F, off-campus activities. Off-campus activities for the completion of the course requirements, for example, our NSTP, internship, practicum, training, fieldwork, etc., may be allowed, subject to the approval of the concerned local government unit or LGU. Next slide, please. Letter G on the co-curricular and extracurricular activities. In-person and group-based co-curricular and extracurricular activities such as sports, events, musical events, competitions, in-person graduation rites, ceremonies, among others, may be allowed subject to the approval of the concerned LGU. Compliance with the applicable health protocols and to the conditions laid down under the IATF resolutions. To wit, number 1, for areas under Alert Level 3, a maximum of 30% indoor venue capacity and 50% outdoor venue capacity for fully vaccinated individuals. Number 2, for areas under Alert Level 2, a maximum of 50% indoor venue capacity and 70% outdoor venue capacity for fully vaccinated individuals. And number 3, for areas under Alert Level 1, full indoor and outdoor venue capacity for fully vaccinated individuals. Now, in the event of the new IATF resolutions on the conduct of events or ceremonies, such is deemed part of the issuance and should be observed. Next slide, please. On medical assurance, ICE shall ensure that students who will participate in limited face-to-face classes under this JMC and subsequent guidelines to be issued by CHED are registered with PhilHealth, either as a direct or indirect contributor, dependents of the direct contributor, or with equivalent medical insurance that covers medical expenses related to COVID-19. In case of violation in this provision, and it is shown that a student gets infected by COVID-19 brought about by his or her participation in the limited face-to-face classes, the HEI shall facilitate the necessary medical treatment or procedures for the affected students. Next slide, please. Section 5 on the specific guidelines. Prior to the reopening of campuses of HEIs for the limited face-to-face classes, for all programs under alert level system for COVID-19 response, the HEIs shall undertake the following. Number 1, conduct a self-assessment checklist on the readiness of HEIs to reopen campuses for limited face-to-face classes. Number 2, establish a crisis management committee. Number 3, establish a cyclical student shifting system. Number 4, determine the maximum venue capacity of the facilities. Number 5, implement additional health and safety measures. Number 6, conduct simultaneous or simulations and drills. And lastly, number 7, create contingency plan for COVID-19 cases. Next slide, please. For specific guidelines, letter A, conduct a self-assessment checklist on the readiness of HEIs to reopen. Yes. Hello? Hello, naririnig niyo po ako?
Yes, RD.
Okay. I just heard a feed, nag-frozen daw ako. Okay, so can I proceed, please? Hello?
Yes.
Okay, thank you. Okay, so to continue, okay, on the section 5, specific guidelines on the checklist, my dear HEIs, especially those who are familiar of doing the preparation for limited face-to-face classes, pareho pa rin naman po. But in the case of the others who are still new in the preparation, please allow me to enumerate because this is very important for all HEIs, okay? So we have component number 1, the management and oversight. Okay, so there should be a crisis management committee or equivalent. The student, parents, or guardians, faculty, and staff had been consulted. Stakeholders have already been oriented and given information, education, and communication materials detailing institutional policies, guidelines, and procedures on the safe conduct of limited face-to-face classes and health and safety protocol. The HEIs has informed parties involved in the conduct of limited face-to-face classes. So lahat po ng parties, ano? Okay, faculty, students, non-teaching, the LGUs, and whoever is necessary for the consideration of the parties. And then the HEIs has a database for the list of programs, courses, and year levels, as well as the number of students and HEI personnel who will participate in the limited face-to-face classes. The HEI has identified the buildings, classroom, laboratories, and other facilities to be used for program in the conduct of limited face-to-face classes. The HEI has a system to ensure the students and teaching and non-teaching personnel who will participate in the limited face-to-face classes. And there is a verification system on the vaccination status of individuals who will participate in the limited face-to-face classes. Next slide, please. Number 2, on the institutional policies and protocols, which is very, very important because we have to make sure that everybody knows what should be done inside and outside the HEIs once the limited face-to-face classes already started. So there are contact tracing protocols, including the use of StaySafe.ph or digital contact tracing application. There are screening and detection, containment, and lockdown protocols. There are emergency transfer protocols to be followed in case anyone exhibit COVID-19 symptoms while inside the campus. There are referral system protocols for COVID-19 suspects or confirmed cases and psychosocial services. There are quarantine and isolation protocols. There are physical distancing protocols. There are maintenance, cleaning, sanitation, and disinfection protocols for built environments such as the buildings, among others. And lastly, hindi ko po siya mabasa dahil ang daming message po. Okay, lastly, there are protocols on the appropriate use of PPEs. Nababasa ko po, no, may mga nagme-message po ng inyong mga katanungan and request for presentation. Yes po, magpo-provide po ang secretariat sa inyo. At isave nyo lang po yung question ninyo. Meron po tayong open forum later on. Okay, next slide please. Next slide, please. Okay, so there is a cyclical student and employee. Oh, please go back. Thank you, Secretariat. Yung sumunod pa po, no, may cyclical student and employee shifting implementation plan. There is a predetermined seat plan, school-based COVID-19 surveillance program, facility for the proper storage, collection, treatment, and disposal of the used face masks and other infectious waste, communication plan to provide timely and updated information, catch-up plan for learning when limited face-to-face classes are suspended. School canteen, cafeteria, and other food establishments have health and safety protocols in line with DTI-DOTR JMC number 21-02 or the health and safety guidelines governing the operations of indoor and outdoor dine-in services under the alert level systems. Okay, sandali lang po, natatakpan po yung aking sinasabi ng mga messages, okay, for COVID-19 response. And lastly, there is a cyclical student and employee shifting implementation plan. So ito po ha, mahalaga po itong mga checklist na to, kaya po iniisa-isa po natin. At yan po kasi ang isa-submit nyo sa mga CHED regional offices. Okay, Next slide, please. On number 3, the last one, yung controls naman po. There are engineering controls to ensure physical distancing, adequate ventilation, physical hygiene, and environmental hygiene are observed. There are visible, readable, and adequate number of signages, signals, reminders on health and safety protocols, placed, posted in strategic and conspicuous places inside the campus. There are hand washing facilities and an adequate supply of sanitation products installed or placed in strategic areas. There is a standby setup of a single person isolation room inside the campus. And there is an adequate air exchange in enclosed or indoor areas as cited in DOLE DO number 224-21 or the guidelines on ventilation for workplaces and public transport to prevent and control the spread of COVID-19. There is a foot traffic system. And lastly, there is a screening or triage area in different points of entry. Next slide, please. Ayan. Now, establishing the crisis management committee, responsibilities of the crisis management committee. Next slide, please. Okay. So, composition of the crisis management committee. So, school head, the president, okay, or administrator in some cases, institutional health officer, institutional safety officer, institutional planning officer, information officer, surveillance officer, health and safety marshal, at least one po no, per building, head of the clinic of the HEI, and representative from the faculty association and student association. On the function of the crisis management committee, letter A, assess the readiness of HEIs to reopen for limited face-to-face classes. So kasama niyo po sila sa pag-a-assess. Take charge of the application to reopen. Disseminate appropriate and relevant information to stakeholders. Oversee the implement of health and safety protocols. Monitor and evaluate the compliance of HEI with this JMC. Conduct of school-based COVID-19 surveillance, and lastly, take the appropriate measures when risk and impact of COVID-19 may exist in the campus or surrounding communities. Example, presence of suspected and confirmed cases have been reported inside the campus. So, as you can see, the function of the Crisis Management Committee really corresponds to the composition of the said committee. Next slide, please. School-based COVID-19 surveillance. Number 1, the CMC shall establish the school-based COVID-19 surveillance led by the institutional surveillance officer with the following responsibilities. Letter A, facilitate the collection of pertinent data about suspect, probable, and confirmed cases identified in the school during the conduct of limited face-to-face classes. Letter B, maintain a case-based listing for students and teaching and non-teaching personnel with the following variables at a minimum in the database, or the database can be password protected using Excel spreadsheet. So there should be the name of the HEI, name of the program, student, teaching personnel, non-teaching personnel identified like the ID number, the sex, age, vaccination status, presence of any comorbidity and disability, date, symptom detected, date of testing, date of release of result of test. And we have to secure the list of the identified close contact of the suspect, probable, and confirmed case of the HEI facility, determine and monitor case clustering, provide data analytics, inform decision-making at the HEI level, report relevant data to the CHED-DOH as part of the weekly COVID-19 monitoring report. Please refer to the Annex C of the said JMC, and coordinate with the head of the local epidemiology and surveillance unit for activities related but not limited to surveillance. Next slide, please. Section 5, specific guidelines on this establish a cyclical student shifting system.
Ma'am Tess,
Yes, attorney?
that's mine.
Okay. Okay. So at this point in time, I would like to turn over the virtual microphone to my partner, my co-TWG member, Attorney Joselito Aliswag of CHED-DOH Mimaropa. Attorney, please.
Maraming salamat. Hindi na po ako babati. Nabati na kayo ni Ma'am Tess. Special lang na pagbati sa aking mga kareyon sa Mimaropa at saka yung mga tinamaan ng bagyo sa aking mga kalalawigan sa Palawan. Amblig pirmi mga tangay. Ganyan talaga ang buhay. So magsumikap tayo, makarecover tayo sa bagyong ito. At syempre, special na pagbati doon sa birthday po ng kasamahan namin sa CHED Mimaropa, si Engineer Vic Cunanan. Na kung nasaan ka man, baka naman. Anyway, ito po yung implementation of cyclical student shifting model. To further reduce the COVID-19 reproduction number by limiting the number of students present on the campus on a given day, ang HEI po should adopt a cyclical student shifting system. Ito po yung modelo na kasalukuyan ngayon, yung 417 or 410 model. Pero bahala kayong pumili kung sa tingin niyo kung ano yung nararapat na shifting model. Yung 417, yung nasa campus yung estudyante for 4 consecutive days for the face-to-face classes, then off campus siya for 17 days. Yung 410, nasa campus yung estudyante 4 days, then off campus 10 days. But this formulation depende yan sa inyong situation, what you deem best, of course. And we advise that those should be implemented in consultation with the faculty and the students. And in some cases, sa ibang campuses, they consult also the parents, no? And it's for you to adapt, and of course, you should inform and get the permission of the local IATF. Ito po yung bagong formula na pinag-uusapan, yung tinatawag na cyclical student shifting model. Next slide. Now, sabi nga nila, bahala na kayong magpasya sa capacity ng inyong schools. Sa environmental planners, we call this carrying capacity. Pero bago yan, you should re-engineer or redesign or retrofit your facility so that yung social distancing na at least 1.5 meter. Minimum po yan. You could do it 2 meters sa retrofitting ng inyong mga estudyante, yung kanilang mga upuan. And you determine the number of students present inside the classroom, laboratories, libraries, gym, etc. Pero ang mahalaga is you maintain the minimum 1.5 meter physical distancing. And you determine the number of students or persons inside the campus to enter within a given day. That's your responsibility, and we entrust you that because we don't want to enforce the cajon solution to your physical layouts because iba-iba po ang configuration ng bawat campuses. Then these are the additional health and safety measures. Next slide. Yes, you will require our students, teaching and non-teaching personnel to bring their own personal hygiene kits. Well, hand sanitizer, tissue paper, toilet paper, hand towel, extra face mask, or hand soap. Do you require face shield? Depende po yan sa inyo, sa desisyon ninyo. Next slide. Okay, ito na po yung pagpapalawig tong sa Parang trials, isa trials area natin, ano? You should put up, ang word po ito shall, so this is mandatory. A screening or trials area at different points of entry where students, teaching and non-teaching personnel and visitors are assessed for the following. Una, face mask or face shield, depende sa hinihingi ng local IETF. A health declaration form or accomplished health declaration form. Sa iba naman, meron na kayong biometric system. That's doable. Then a body temperature check. So, ang threshold po, lagi natin ay 37.5 degrees. Pag 37 kasi, di ba, sabi nga ng mga doktor, tawag natin yung mga magulang may sinat na yung bata. Di ba? Pag umabot ng 37.5, yun ang threshold natin. Back pa, may isa pa. Okay, next slide. The HEL shall maximize and improve natural ventilation in all rooms and common areas. So when we say natural na hangin, does that include air conditioning system? And of course, there are certain times when you have an air conditioning system, the exhaust system should be good, no? Negative force, sa room. You shall assess ingress and egress, yung entrance and exit. We usually suggest magkahiwalay talaga yung pasukan tsaka labasan. Sana walang salubungan, no? And then HEL shall require students to go straight to their assigned rooms upon entering the campus. No loitering around. Next slide. Then the HEI shall require faculty and instructors to have seating plans indicating the assigned seats of students. The idea, of course, is dapat wag palipat-lipat. Then the HEI shall implement a one-way foot traffic system to limit human intersection, contact, or interaction. May marking po ito sa floor to indicate the direction and proper distancing to follow from the entrance gate to the room and within the room. But you may employ other traffic system as long as this shall limit human intersection, contact, or interaction. Then the HEI shall adopt other measures to limit the movements of students, including measures prohibiting students from moving from one room area to another without proper authority or reason. Tawag niya galibanting or loitering around shall not be allowed. Then classrooms, laboratories, communal areas, other school facilities, as well as equipment used by the students shall be cleaned and disinfected at the end of each school day. Yeah, marami nagtatanong po dyan ang cleaning ba na every other day, etc. The joint circular says it should be every day. School canteen and dining areas. In case that the school canteen or cafeteria will not open, in other words, you're allowed to open your cafeteria or school canteen, the HEI must inform students to bring their own food and drinks. Students shall not be allowed to leave the campus premises between classes to buy food and drinks. Ano ibig sabihin po nito? Kaklaro ko lang. In other words, pwedeng magkaroon ng school canteen at cafeteria. Kung hindi, sabihin sa mga estudyante na magdala kayo ng sarili niyong pagkain. Because the students shall not be allowed to leave the campus. Hindi sila pwedeng lumabas to buy food and drinks. B. Personnel of the school canteen must be fully vaccinated against COVID-19 and must wear PPE to ensure food safety. The school canteen must follow DTI, DOT, or JMC for the health and safety guidelines on the operation of food establishments. So question, nakalagay dito school canteens. So only school canteens, authorized school canteens are allowed to sell food within the campus. C, only packed food and drink shall be allowed for selling. No open buffet, etc. na tinatakal o sinasandok. D, food deliveries are not allowed. So, bawal pa magpadala ng pagkain sa loob. So, walang Grab food, walang Food Panda. Papasok sa loob ng school. Students are highly encouraged to eat at their assigned seats inside their respective classrooms. However, HES may also set up a dining area. These extra precautionary measures may be taken because face masks will be removed to enable the students to eat and drink. Ito ay doon kung walang canteen, encourage natin sila kumain doon sa loob ng classroom. Break time period. The HEI must determine the break time period. There shall be staggered break time to lessen the number of possible occupants in the school canteen and dining area. Hindi po pwedeng sabay-sabay. B, HEI shall determine the maximum time an individual can stay in the school canteen, dining area, as well as the maximum number of occupants in the period of time. Hindi na pwedeng tumambay sa ating mga kantina, sa mga kainan. Students are not allowed to eat in laboratory rooms where activities that involve the use of chemical and biological agents are being done. They shall eat in a designated dining area. So pag sa laboratory lang po yan, dapat hindi sila pwedeng kumain sa loob ng lab. Next slide. Ito naman tungkol po sa library services. No? Kung may mga physical library pa po kayo. The HEI shall determine the maximum time limit a student and teaching and non-teaching personnel can stay inside the library and the number of times he or she can enter the library per day. Magtatakda po kayo ng takdang oras sa panahon kung gaano kahaba pwedeng mamalagi sa library ang ating mga mag-aaral, guro at mga kawani. If books, journal, library materials are borrowed and brought home or taken outside the library facilities, there shall be a dedicated drop box for their return. These books shall be properly cleaned, sanitized, disinfected before they are again included for circulation. Wala pong hand-to-hand, no? Abutan. No? Dapat may drop box. C, commonly shared computer units shall be cleaned and disinfected before and after use. Yung mga common computers, lilinisin po bago at matapos gamitin. D, the HEI shall encourage their students and teaching and non-teaching personnel to use online library services instead of physically going to the library. Ito po yung digital library system. The HEI shall also promote the PhilChed Connect for free access to instructional and learning resources materials. So digital library and learning commons are now in. So yun po yung tunguhin ito. Next slide. Ito po yung simulations and drills. Ito po yung ating mga pagsasanay. Go, next slide. Yan, ito po. Number 1, prior to reopening of campuses for limited face-to-face classes, HEI shall conduct simulations and drills of the human traffic system, crowd management, and classroom management and implementation of their health and safety protocols. Marami po tayong simulation and drills na gagawin sa traffic, sa capacity, etc. Isa-simulate po natin yan. Second, HEI shall also plan how to conduct drills on fire, bomb threat, earthquake, and other emergencies adherent to health and safety protocols, most especially physical distancing and use of PPE. Ito po yung mga man-made tsaka natural disasters, of course. Fire, bomb threats, earthquake, and lalo-lalo na sa atin ngayon, yung mga natamaan tayo ng bagyo. No? Kasama po yan sa ating drill on evacuation, etc. Third, HEIs shall have health and safety marshals at least one per occupied building area, roaming around the campus to monitor strict implementation and observance of the health and safety protocols at all times. Bawat building po ay dapat may health marshals tayo na lumilibot at nagsisiguro na we are observing health and safety protocols. Bawat building po yan. Next slide. Next slide. Ito po yung ating mga contingency plan. HEI shall have a contingency plan ready to be implemented when students, faculty, or staff are identified as suspect, probable, confirmed COVID-19 cases while inside the campus. Meron po tayong plano kung sakaling merong mag-positive sa loob ng ating campus. Kasi may mga kaso na pumasok ng umaga, wala pang nararamdaman, pagdating sa klase, nakaramdam na. Yan. Number 2, the contingency plan shall be tested and continuously refined with representatives from the LGU, such as but not limited to the local health officer, local epidemiology and surveillance unit, and or local disaster risk reduction and management officer involved in the development, scenario-based planning, and simulation of the plan. Yung pong ating mga LGU ngayon, mahuhusay na sa ganyang sistema. So, we should involve them. Ito po yung ating mga dapat lalamanin ng ating contingency plan. These are the minimum measures. A, the individual shall be transferred immediately. Ito bigla nagkakasok kayo sa loob. The individual shall be transferred immediately to an isolation room inside the campus while waiting to be transported to a health facility or his or her home. Dapat meron tayong isolation room within our campus. Yung iba, ina-advise namin na more than one. No? O lalo kung masyado malalaki yung campuses ninyo, sometimes kailangan nyo na more than one. No? At dapat may sariling toilet o comfort room o may mahihigan din yung bata. HEI shall notify at once the individual's family member or guardian who shall be requested to transport him or her to a health facility or back to his or her home. The HEI shall provide the necessary assistance to ensure the safe transport of the individual. Kung maaari sana, baga matatawagin natin yung miyembro ng pamilya, ay dapat sana ay meron tayong sasakyan na magagamit natin para dito. If the student and or teacher or the non-teaching personnel live in a dormitory boarding house and do not have a family member, guardian living nearby, he or she shall not be allowed to return to the dormitory or boarding house. The HEI shall transport him or her to a health facility, monitor his or her health condition, and regularly update his or her family if possible. Kung estudyante ay walang kamag-anak at nagdo-dorm lamang, responsibility po natin na dalhin siya sa isang health facility. Next, the individual shall be evaluated by the appointed medical or health and safety officer who is knowledgeable on, ibig sabihin, yung ating isolation area, dapat may health personnel. On how the disease spreads, how to identify disease symptoms, how to protect themselves, environmental cleaning and disinfection procedures, and when to contact health officers or occupational health services. Dapat may magpapasya na health personnel kung dapat na itong dalhin sa health facility or papaswab muna yun. The decision should be scientifically based. The Crisis Management Committee or equivalent committee of HEI shall conduct a risk assessment of the situation and implement the appropriate health and safety protocols such as but not limited to contact tracing, cleaning, and disinfection of facilities or suspension of classes and operations. Ito po yung reiteration lang na yung Crisis Management Committee natin. Kumbaga yun ang ating local IATF, campus IATF natin. Next slide. Yan. Upon the determination of the HEI of its compliance with the guidelines, ito na po yung procedure. HEI shall notify the CHED-DOH concerned of its intention to reopen its campus for one, some, or all of its program for limited face-to-face classes prior to the start of the semester or proposed reopening date. Such notification shall be accompanied by dalawa lang dokumento. Accomplished self-assessment checklist on the readiness of HEIs to reopen campuses for limited face-to-face classes. Annex A po ito ng presentation na ito na ipapadala namin sa inyo lahat. Pangalawa, notarized affidavit of undertaking referred to Annex B. Ito po yung Annex B ng dito. To the concerned CHED Regional Office. Dalawang dokumento lang po ang hihingin namin. I-notify nyo kami na inyong kagustuhan to reopen campus or any of your campus, then you accomplish these two forms. No? The self-assessment checklist and the notarized affidavit of undertaking. Ang tawag naming mga abogado dyan sa affidavit of undertaking, bahala ka dyan, form. Next slide. Control.
All right. I think Attorney Aliswag is reconnecting. So let's just wait for Attorney Aliswag, no? So, okay. While waiting, you may already think of your questions, no? And later on, we'll be giving you time to send them in via our chat box. Okay. So while Attorney Aliswag is reconnecting, maybe you present again the frequently asked questions, perhaps? And allow the chat box for our participants to send in their questions, no? We thank also our participants for sending their email addresses, although we already have the copies of the email addresses of the registered participants. Later on, we'll be allotting time more for that. No? Okay, sige. Okay. All right, let's all watch this. Thank you.
Question number 1. Is the resumption of limited face-to-face classes mandatory? The answer is no. As stated in Section 4A of CHED-DOH JMC number 2021-004, limited face-to-face classes are not mandatory. HEIs are given the discretion to conduct limited face-to-face classes or to continue the implementation of flexible learning modalities. If the HEI opts for flexible learning modalities, they shall be governed by the provisions under CHED Memorandum Order Number 4 Series of 2020 or the Guidelines on the Implementation of Flexible Learning. Question number 2. Do we need to secure a permit from CHED to conduct limited face-to-face classes? The answer is no. The HEI must comply with the provisions of CHED-DOH JMC number 2021-004 and do a self-assessment if they can comply. If based on the self-assessment, the HEI is compliant, the HEI may conduct limited face-to-face classes. HEIs should, however, notify the CHED through the CHED-DOH by submitting an accomplished self-assessment checklist and notarized affidavit of undertaking. Question number 3. Do we need additional permits to continue the conduct of online classes? The answer is no. The conduct of flexible learning modalities which includes online classes, shall continue to be governed by CHED Memorandum Order Number 4, Series of 2020, or the Guidelines on the Implementation of Flexible Learning. Question number 4. Are schools required to put up plastic barriers inside the classrooms? The answer is not required. HEIs shall develop and strictly implement institutional policies and actions that revolve around and conform with the minimum public health standards mandated by the IATF and DOH. HEIs are recommended to utilize visual cues and floor markers as needed. Question number 5. Are students required to wear face shields? The answer is wearing a face shield is optional in areas under Alert Level System 1 to 3 per IATF Resolution Number 149. As administrative prerogative, HEIs may add stringent health measures if deemed fit. However, this may be mandatory, subject to new directives of the IATF or LGUs. Question number 6. Are students required to have PhilHealth? Can they get insurance coverage from other HMOs? The answer is yes. As stated in Section 4H of CHED-DOH JMC number 2021-004, HEI shall ensure that students will participate in limited face-to-face classes under this JMC and subsequent guidelines to be issued by CHED are registered with PhilHealth or with equivalent medical insurance that covers medical expenses related to COVID-19. Students may be direct or indirect contributor, dependents of direct contributor for PhilHealth.
Okay, thank you very much. That was again our frequently asked questions as earlier presented today. Now we continue with the presentation with one of our TWG members again, Dr. Maria Teresita Semana, Hdis. Ma'am, good morning po.
Ayan, good morning. Can you hear me clearly?
Yes, ma'am. Yes, ma'am.
Okay, so on behalf of Attorney Joselito Aliswag, our co-member for the technical working group, continuing on the preventive suspension and reopening protocols. So we have this table with us. So on the scenario, the locality of the HEI is reclassified to alert level 4 or 5, okay? Then suspension of protocol, we have automatic preventive suspension for the entire HEI. And reopening protocol, we have reclassified to alert level 3 or better. Now, on the locality of the HEI is under granular lockdown. Suspension protocol will be automatic preventive suspension of the entire HEI. And then reopening protocol, pag okay na po, granular lockdown is lifted. On the scenario that school or the building or the classroom lockdown for case clustering, meron po tayong definition ng case clustering as defined in our definition of terms and in the legend below the table. Suspension protocol will be, the preventive suspension will be based on the assessment and decision of the Crisis Management Committee of the HEI and upon consultation with the local task force against COVID-19. And the reopening protocol will be continue limited face-to-face classes after completing the contact tracing and disinfection activities and quarantine period for the confirmed and suspected cases. Okay, so moving forward to the next slide on section 7, monitoring and evaluation. For the implementation of the limited face-to-face classes for all programs, HEIs are required to submit their monitoring and evaluation reports to their respective CHED-DOHs to ensure that compliance with health and safety protocols and with this JMC is sustained. The HEI shall submit the weekly COVID-19 monitoring report, again refer to Annex C of this JMC, and other M&E reports as may be requested by concerned CHED regional offices. Then we have CHED composite team may conduct random inspection in order to determine compliance of HEIs with this JMC. Okay, so ayan po ha, meron po tayong random inspection. On Section 8, roles and responsibilities for HEIs. Number 1, ensure that only fully vaccinated individuals, the teaching and non-teaching personnel and students, participate in the limited face-to-face classes. Number 2, conduct consultations with students, teaching and non-teaching personnel, LGUs, and other relevant stakeholders regarding their action plans for reopening their campuses while mitigating the risk of COVID-19 transmission. Number 3, inform all participating students, teaching personnel, and non-teaching personnel of these guidelines. Number 4, retrofit their facilities in order to comply with the minimum public health standards. Number 5, monitor and evaluate the implementation of health and safety protocols and compliance with this CHED-DOH JMC. Number 6, comply with the health and safety protocols of concerned LGUs by virtue and ordinances or orders. Number 7, create a database for the list of programs, courses, year levels, as well as the number of students and HEI personnel who will participate in the limited face-to-face classes. Number 8, conduct school-based COVID-19 surveillance program. Number 9, conduct weekly monitoring of COVID-19 cases. Number 10, submit COVID-19 monitoring reports to the CHED-DOH concerned. And number 11, continuously make improvements in their institutional policies and guidelines. Next slide, please. Attending students, teaching, and non-teaching personnel. Number 1, strictly adhere to the health and safety protocol of their respective HEIs. And number 2, be transparent in declaring health conditions, including those of family members and vaccination against COVID-19 status. Napakahalaga po ito, no? Kahit tulang ang function na gagawin ng ating mga student, teaching, and non-teaching personnel, mahalaga po ang kanilang commitment na maging transparent. Next slide, please. CHED Central Office. Number 1, disseminate this CHED-DOH JMC to the CHED-ROs and HEIs. That's why we are doing this public hearing and public orientation. Number 2, conduct orientation for CHED-ROs and HEIs on the CHED-DOH JMC. Ayun, number 1 pala po. Nakapag-public hearing po tayo and I hope you attended that. And now po, ito na yung orientation kasi ready to implement na po tayo. And then number 3, investigate non-compliance of HEIs with this JMC and recommend immediate suspension on the conduct of limited face-to-face classes. And lastly, number 4, provide data analytics at the national level from the submitted reports of the CHED-ROs. Next slide, please. Next slide, please. Okay, for the CHED regional offices, number 1, closely monitor and conduct the conduct of limited face-to-face classes by HEIs. Number 2, immediately report any violation or complaint and results of the investigation to the CHED Central Office. Number 3, order preventive and immediate suspension of HEI for the conduct of its limited face-to-face classes for violations of this JMC. Number 4, submit a status report on the implementation of limited face-to-face classes and a consolidated weekly COVID-19 monitoring report of HEIs to the CHED Office of the Executive Director. Number 5, review application documents of HEIs for safety seal. And number 6, issue a safety seal in line with the supplemental guidelines to be issued by CHED on the safety seal to HEIs that have been inspected and found compliant with the CHED-DOH JMC. Perhaps po we can elaborate more on the safety seal in the open forum. Okay, because that will be another guideline. On the CHED composite team, number 1, conduct inspection of HEIs who will apply for safety seal in order to check for compliance on the minimum public health standards set by the government and to verify the application documents and integration of digital contact tracing application. Number 2, investigate reported violations and complaints. And lastly, number 3, recommend withdrawal of the safety seal for HEIs that were proven non-compliant with the requirements of the safety seal. For the LGUs, number 1, issue clearance to HEIs on the conduct of limited face-to-face classes. Number 2, provide advice, recommendation to HEIs for the safe reopening of their campuses, pertaining to but not limited to referral and coordination protocols for surveillance, detection, contact tracing, isolation, quarantine, and treatment, and monitoring and evaluation of contingency plans and corresponding simulation exercises. Number 3, participate in the inspection of retrofitted facilities of HEIs and check for compliance with the minimum public health standards. Number 4, designate its health and safety officer to join the ad hoc team or body that shall be created by the CHED-DOH to investigate violation of this JMC or complaints on the implementation of health and safety protocols. And lastly, number 5, provide assistance to HEIs in crowd and traffic control whenever needed. Next slide, please. For the Department of Health, number 1, provide technical assistance such as updates regarding public health standards to be followed in education settings, the institutionalization of healthy settings in the schools, and assistance in the inspection of retrofitted facilities of HEIs as necessary. And number 2, provide learning and development intervention, informational and advocacy materials on strategies or measures through the provincial, city, and or municipal health offices and its local health boards in partnership with the Sangguniang Kabataan Federations and its local youth development council to ensure that minimum public health standards are met for disseminations to HEIs. Next slide, please. On Section 9 violations, any violation of these guidelines shall be ground for suspension of the conduct of the limited face-to-face classes without prejudice to each other sanctions as may be imposed if public interest demands such as, but not limited to national security, public safety, and public health. CHED may, without notice, order an HEI for a preventive and immediate suspension of the conduct of its limited face-to-face classes. On Section 10, Repealing Clause, other related issuances not consistent with the provision of this JMC are hereby revised, modified, or rescinded accordingly. Nothing in this joint memorandum circular shall be construed as a limitation or modification of existing laws, rules, and regulations. On Section 11, Separability Clause, should any provision of this JMC or any part thereof be declared invalid and other provisions insofar as they are separable from the invalid ones shall remain in full force and effect. On Section 12, Effectivity, this CHED-DOH Joint Memorandum Circular shall take effect immediately upon its publication in the Official Gazette or in any newspaper of general circulation and filing with the University of the Philippines Law Center Office of the National Administrative Registrar or the UP ONAR. And we have all the annexes. Kindly click the link for your references, including po yung mga nabanggit po namin mga annexes, specifically yung checklist po at saka yung affidavit of undertakings. Ano po, may mga nagtanong po sa inyo, nagre-request ng copy, nandiyan po yung link. For the references, ayan po lahat ng listahan. Hindi ko na po iisa-isahin. And with that, may I respectfully turn over the virtual microphone to our MC. Mr. Ralphie, salamat po.
Thank you very much, RD, Semana. Maraming salamat po, ma'am. So that's our presentation for the CHED-DOH JMC 2021-004 Guidelines on the Implementation of Limited Face-to-Face Classes for all programs of higher education institutions in areas under alert level system for COVID-19 response. Maraming salamat po sa ating technical working group members represented by Dr. Semana and Attorney Hdis. Maraming salamat po, ma'am and sir. Okay, so this time I know you're excited to hear the answers to your questions, clarifications, and queries. No, so we have received the same. You may continue to send in your questions via our chat box, and we will answer them in the next portion of our program, which is the open forum. So at this time, we are graced with the presence of our very own Executive Director, Attorney Cinderella Filipina S.B. Tesaro, Executive Director of the Commission on Higher Education, as well as the Chair of the Technical Working Group on Limited Face-to-Face Classes. Ma'am Cindy, good morning po.
Hi, good morning. Good morning to all the participants of today's public orientation. Of course, we welcome all the presidents, officials of our higher education institutions.
Yes, ma'am. Thank you very much, ma'am. And to start with the questions of our HEIs, let's first have this question. Yeah, and before that, of course, we have open forum guidelines. No, you may chat your questions via our chat box. You may also use the raise your hand button feature found on your screen. If you wish to speak, kindly wait to be acknowledged before unmuting your audio. Due to time constraints, we will entertain a maximum of 20 questions only. Okay. Sige. First, thank you for those who gave feedback that the frequently asked questions video or FAQs were very helpful. So we will send a copy of the FAQs later on after the event via the email address registered for this event. And of course, you have taken note of those who already sent in again their email addresses via our chat box. Okay, first question from Hernan Erotrita. What sort of support can we expect from the municipal, city, provincial, LGUs in cases of campus transmissions and in the event of lockdown situation? Again, the question is, from Hernan Erorita, what sort of support can we expect from the LGUs in case of campus transmission and in the event of lockdown situations? I think Cindy would like to answer.
Okay, that is why it is very important that before, of course, before we can open, that there should be no objection from the local government unit concerned. That is also one of the provisions or conditions laid down by the IATF resolution. As to support, the local government units have already instituted mechanisms in case there is a community transmission. Di ba meron na po sila mga isolation rooms, may mga LGU po tayo, may mga quarantine centers already, and that can be tapped also in case there will be transmission on the part of our students or on the part of stakeholders participating in the limited face-to-face classes. I understand also that there are some LGUs which have also tapped our higher education institutions for quarantine centers. So these are some of the areas in which our LGU might help our higher education institutions. There are also local government units who are providing, of course, yung sa vaccination. Marami po tayo mga local government units who are aggressive, who are proactive in ensuring that the higher education students and the faculty members and non-teaching personnel will be vaccinated. There are also local government units which are providing the swab testing, but of course, based on the guidelines provided by the Department of Health. So these are just some of the areas in which local government units might help our higher education institutions.
Thank you very much, Attorney Cindy. I hope you were able to answer your question, Sir Hernan. Next question. Should HEIs acquire permit from LGUs for limited face-to-face classes as part of the requirement to offer the face-to-face program? Same question comes from Hernan Erorita.
No, as you have seen in our guidelines, there's no need for you to get a clearance from the local government unit. Although we understand that there are some local government units, once we have issued the guidelines, they might issue guidelines on their own for the clearance. So the general rule is that you're not required to get clearance from the local government unit unless your local government unit requires you to do so.
Thank you very much, Ma'am Cindy. So again, we are still in the presence of Dr. Simane and Dr. Aliswag. If ever there are questions that can be answered also by our TWG members. Okay, next question from Dentistry Dean Danilo Magtano of UP Manila. Good morning. Dentistry programs puts premium to skills acquisition demanded by the profession, oral health service to the community, and program outcomes. Training of our students requires actual patient care and encounters. Most procedures are classified as aerosol generating procedures. Aside from the stipulations contained in JMC 2021-004, will there be additional and or specific guidelines in the conduct of the clinical sessions, no matter how limited?
There are specific programs which we have issued already guidelines for the conduct of limited face-to-face, specifically the internship components of their program. For instance, we have issued guidelines for limited face-to-face classes for programs such as engineering, maritime, of course, our health programs such as dentistry, of course, medicine, nursing, pharmacy. So these specific programs or these specific guidelines are still valid, are still subsisting. Ibig sabihin po, yung guidelines that we have laid down in our specific programs will still prevail, especially po doon sa internship component. So as to dentistry, to answer the question of Sir, is that there is a specific guidelines for the conduct of limited face-to-face classes for dentistry program. So you might refer to that guidelines for such programs that we already have guidelines for.
Thank you very much, Cindy. Next question is from Nemsu Jerry Estrada. What if the HEI will opt to implement the face-to-face classes on August instead? Is it allowed?
Yes, the answer is yes. An HEI might decide to open their limited face-to-face classes in the next semester or in the next academic year. That is within the discretion of the higher education institution.
Thank you very much, Ma'am Edie. So I think this is a further clarification based on the presentation earlier. This is from Visayas State University, from Ma'am Magdalene Unahan. In cases of positive cases of COVID-19 in the campus, will the classes be suspended in the entire university while contact tracing is conducted? So I think before, as we answer the question, ma'am, I will ask the Secretariat to share the screen for that part of the guidelines. Yes, Ma'am Cindy.
Okay, sige, paki-show on our screen the specific provision in our guidelines. The determination on whether there will be suspension of classes will be based on the case clustering. So, hindi po ibig sabihin may isang nag-positive ay i-close na. We have already laid down a scenario in which in case there is a case clustering, the case clustering has been already defined in our guidelines already. So, in case there is may case clustering, ibig sabihin ay mayroon pong mga, kumbaga meron po tayong cases talaga which can be considered as case clustering, then it will be based on the suspension of classes will be based on the assessment and decision of the Crisis Management Committee of the HEI, but should be done in consultation with the local task force against COVID-19. So ang ating mga local government units have already instituted a local task force against COVID-19. So in case there is a case clustering, the Crisis Management Committee is responsible to coordinate with the local task force to determine on whether they should proceed with the suspension of the classes.
Thank you very much, Ma'am Cindy. Next question from Charity Grace Santillan from Febias College of Bible. May I ask if you have a separate policy guidelines for schools with dormitories? Thank you very much.
We do not have separate guidelines for schools with dormitories. Kasi sa conduct or yung sa pagpapapasok sa dormitory, I think that is within the parang the jurisdiction or supervision of the local government unit concerned already. So if in case you will have your students return to their dormitories, I suggest that you coordinate with your local government unit concerned. Kasi may interzonal, may intrazonal travel concern kasi yon. Kaya that is why we, on the part of higher education institutions, which will, which will have the conduct of their limited face-to-face classes will be together with the operation or the opening of the dormitories. We suggest that for that part, you coordinate with your local government unit concerned.
Thank you very much, Ma'am Cindy. Next question is from ASCAP Assistant Professor Rodolfo Macala. Paano po natin ma-determine ang health and safety protocols in the off-campus students na nagsistay po sa boarding houses? Ma'am Cindy?
Okay. As I've mentioned, that is within the supervision of the local government unit concerned. We have already, the Department of Health has also issued the minimum guidelines that we should follow. So kasama na po yun sa consideration ng local government unit concerned.
Thank you very much, Ma'am Cindy. So again, it's part of the LGU concern. Okay. Next is we have from La Consolacion College, Academic Coordinator, Sir Con Mahilo. Where can we get documents needed for the limited face-to-face classes? As mentioned, such as the self-assessment and the like. Last consultation, those forms were not yet included, of course, sir, because these were now part of the updated and finalized guidelines. Ma'am Cindy. So I think this is just a clarification.
As I understand it, it's already part of our guidelines that we have already posted in our website.
Yes, ma'am. Yes, ma'am.
It's one of
And you
our
can also
annexes. So as to the documents such as the affidavit of undertaking, the self-assessment checklist, you can refer to our website. You can download it and for your reference.
Yes, ma'am. Okay, we will also send the link later on. Okay, next question. From Sir Hernan again. Our present insurance is catered by the Philippine National Red Cross. Does this mean we have to avail of the insurance policy from the PhilHealth? I think this is just a clarification.
As we have mentioned in our guidelines, as long as your insurance insurance already covers for COVID-19, that is okay. But if I may emphasize also that, of course, under our universal health care, we are para may universal coverage under sa PhilHealth. But of course, you have to register. But in case you have an additional insurance, such as we mentioned po nila is a Red Cross, that is okay. And if there is a, I think there, if the COVID-19 disease has been included in the coverage, of course, that is better po.
Thank you very much, ma'am. So I think this question could be answered by one of our TWG members. In effect, once we have submitted our duly notarized documents to the CHED regional office, and we have secured the necessary permit from the LGU, we may proceed with the limited face-to-face classes for the second semester of academic year 2021-2022. That's from Lieutenant VPAA Cristina Cabral. Attorney Lito, would you like to answer? Or?
Yes. You only need to submit 2 documents. You don't need to have our imprimatur to conduct limited face-to-face. So it's your call. Just notify the CHED-DOH.
Thank you very much, Attorney Lito. Okay, maraming salamat po. Next question. Okay, I think this could also be answered by Dr. Simana, ma'am. The question is from Tarlac Agricultural University, if I'm not mistaken, from Ms. Yolanda Huat. Is the composition of the Crisis Management Committee mandatory?
Naka-specify po, naka-enumerate, and as I already discussed the function, makikita nyo po na yung bawat composition po ng crisis management ay may corresponding function. So, although naka-specify po sa guidelines natin, we are encouraging our HAIs to follow. Kasi yung bawat miyembro po doon ay may corresponding function.
Maraming salamat po, Ma'am Simana. Okay. Next question, regarding po sa pag-facilitate the medical treatment of infected students, Ms. Joanne de la Cuesta is asking if clarification for the statement that HEIs will facilitate medical treatment of infected students. What does facilitate entail? Ma'am Cindy, yes.
Okay. So, let me just siguro emphasize also na may mga mechanisms na ang ating mga local government units on the ground. For instance, di ba, meron sila nag-office in isolation, meron din sila mga quarantine centers. So, in case yun na nga, hindi siya covered, of course, yung, di ba, ang full term po, ang full provision po natin is that if a student gets infected, and in case there is a violation of our provision on the registration of the student with PhilHealth or with other insurance provider, including the coverage of COVID-19, then the HEI, it is the responsibility of the HEI to facilitate the treatment of the student. Ibig sabihin, if there is already a mechanism on the ground of our local government unit on how to do the treatment of a student, gamitin po nila yon. But the essence of this is that, yun na nga po, there is a corresponding responsibility also of our higher education institution, especially if they were not able to ensure that yung the registration of our student. Kasi kung may registration ka naman with PhilHealth, and in case there is a need for a hospital facility, kasi as I understand it, meron pong mga kaso pa rin po natin na nahuhome quarantine. So, what we are saying or what we are emphasizing here is that the higher education institution should inform the student of the mechanism, the mechanism of the higher education institution in case there will be infection of the student.
Thank you very much, ECD. So we go now to our participants in the Zoom room raising their hands. Let's call on first from ESAT-U, Dr. Raul F. Muyong, sir.
Yes, good morning.
Yes,
my
sir, good
question
morning.
is, good morning, Attorney Cindy and Ma'am Director Simana and Director Aliswag. My question is on the role of CHED Regional Office, because previously we have to submit to CHED for inspection before we can have the face-to-face. Now, number 5 says here, CHED Regional Office shall review the application documents with CEI for safety seal. And number 6, issue safety seal in line with the supplemental guidelines to be issued by CHED on safety seal to HEIs that have been inspected and found compliant with the CHED-DOH GNC. My question is, do we still need to have the safety seal before we can be allowed to have the face-to-face? Because it states here that we have to be issued a safety seal.
Thank you, President Muyong. I'll answer initially and then I'll give the floor to Attorney Aliswag to answer. The answer is no po. Ang nakalagay po dyan, the responsibility of the CHED-DOH is that in case an HEI, in case a higher education institution would like to apply for a safety seal. If you will apply for a safety seal, then our CHED-DOH will inspect you. But to emphasize, for you to reopen your campuses for limited face-to-face classes, you can do a self-assessment. You will have to do a self-assessment and the submission of the self-assessment checklist and affidavit of undertaking to our CHED-DOHs. Yun lang po yung requirement natin, self-assessment. Yung nilagay po namin dyan na provision na the CHED-DOH might inspect if in case you would like to apply for a safety seal. So, yung application po for safety seal is optional. Ibig sabihin that is not mandatory. It will be within the discretion of the higher education institution. What will be the additional, what will be the benefit of applying for a safety seal? Doon sa safety seal, what we are of course certifying is that the CHED has already inspected the place and it is compliant with the minimum health protocols. Kasi ang difference kasi doon sa self-assessment, of course, since it is a self-assessment, walang third party na nag-inspect noon. But you may reopen. But in case you would want to show to your stakeholders that there was a third party or there is a third party which has inspected your place, which has determined that your school is compliant with the higher education, with the minimum health protocols, then you might apply for a safety seal. And in addition, I think in IATF resolution, there is a additional privilege in case you have a safety seal. Parang may additional na, if I remember it right, parang may additional percentage in terms of the maximum capacity. So, yun po yung benefit of applying for a safety seal.
Attorney, there are also local government units that is issuing safety seal to educational institutions. How will it, of course, CHED will be issuing another one. How about if the educational institutions has already acquired a safety seal from the local government unit?
Okay, we recognize that, we will acknowledge that, President. Actually, we are part of the technical working group also, issuing the safety seal policies and guidelines. So we are aligning also our safety seal guidelines with that of the safety seal guidelines of other government agencies such as the local government unit. So doon sa pag-issue po namin ng safety seal guidelines, of course, we will recognize the safety seals that have been issued to higher education institutions.
Thank you very much, Attorney. Thank you very much,
Okay.
Attorney Aliswag and Ma'am Sis.
Madam Edie, may I also add, please?
Okay, sige po. Sige, Hdis, sige po.
Apo, thank you po. Thank you po, President Dr. Raul Muyong, for your question. And it's really very very important that we have that question, no? Kasi nga po nagbibigay talaga yung LGU natin. But we would like to emphasize po, my dear HEIs, yung LGU po, ang tinitignan nila ay yung safety ng building natin or facilities natin. Ang ating pong guidelines sa CHED is more than that. Kasi we are also looking at the compliance po na hinihingi sa bawat programa po na i-open natin under limited face-to-face classes. And then gusto ko rin pong i-emphasize sa ating lahat na tunay nga po, segunda ko lang doon sa explanation ni Executive Director, hindi po kailangan yung safety seal para po makapag-open kayo, no? Additional bentahe po yon. So tignan po natin yung kagaya ng ginagawa ng DTI sa pag-open po ng mga establishmento. So pwede pong mag-open yung establishmento sa kanila pong self-assessment, pero po additional factor po yung magkaroon kayo ng safety seal kasi yun po ang nagpapatotoo na talagang compliant po kayo in all areas per guidelines po ng CHED and DOH. Yung pong prinsipyo po na ginagawa natin sa ngayong panahon ng limited face-to-face classes, kung familiar po kayo doon sa ina-apply nyo sa CHED na pag meron pong mga field trip ang ating mga estudyante, di po ba meron din kayong undertaking na ginagawa. Ibig sabihin po nun, ang responsibilidad ay sa HEIs. And ina-assure nyo po yung CHED na ligtas po ang ating mga estudyante, faculty members, and non-teaching personnel sa pagpunta po nila sa limited face-to-face classes. So ang mangyayari po dyan, allowed po kayong mag-open, pero yung CHED inspection po ay mangyayari lamang kung meron pong mga complaint or mga kasong pangyayari. Or the other side, the positive side, is kung gusto nyo pong magkaroon ng safety seal. So sana po nakatulong ang explanation ko in support to the explanation of our Executive Director. Salamat po.
Thank you very much, Hdis. Maraming salamat po, President Muyong. Maraming salamat po. Let's call now ALCU President, Region 3, Ma'am Attorney Banas. Maraming good morning po, ma'am.
Please unmute.
Yes,
Okay,
yes.
hindi siya, ayun, nakapag-unmute, ayun. Ma'am Banyas, unmute po kayo.
Ayan na po. Good morning, ma'am.
Because I was not earlier allowed to unmute myself. Good morning, ED, and good morning, Dr. Semana, and all the...
Pwede na po, Attorney Banyas. Ay, nag-mute ulit kayo.
Dene, we can hear her.
Okay. Good morning. First of all, question po. So na-issue na po ba itong guideline na ito? Effective na po ba siya?
Yan, ako sasagot niya. Kasi i-query ko rin kanina. Ang nakalagay sa guideline, upon publication. We're about to publish the guideline. I think so yung po bang meeting natin today is just for us to be oriented or for us to also be allowed to comment? Yes, to consult you on the implementation. Pero for the effectivity of the guideline, the CMO says upon publication and upon submission sa UP Law Center. So I think any day I was informed that we have placed the notice now with one of the newspapers. So baka lumabas bukas or the day after. So pag nabasa niyo sa newspaper, effective na po siya dahil on the same day, we will submit a copy to the UP Law Center.
Yeah, thank you, sir. Because I recall there was already a presentation on this. In fact, it was before early December. Tama po ba, Dr. Semana?
Yes po, yes po.
And at that forum, all of us also attended. The chair was there, likewise. And we thank the technical working group because the presented guideline now is more detailed. And I would like to believe that the purpose is to really guide the HEIs on how to really go along and accomplish the objective of opening classes in a safe manner. So thank you po sa TWG. My only parang towards the last portion of the presentation, as an implementer of the guideline, medyo very strong lang kasi yung portion ng mga violation. Now I understand because apparently there are two options. One is to proceed on our own through a self-assessment and the board resolution and the LGU concurrence, and or further to secure the safety seal, which will attest na merong verification by the CHED. So now I understand after hearing the explanation of ED and Dr. Semana, kanina medyo nakukonfuse ako. Sabi ko bakit parang masyadong very harsh? Kasi parang meron agad na presumption na kami ang kaya nagkasakit kasi you know we did something wrong, or kasi medyo mabigat po lalo na kami ang mag-execute ng undertaking. So I hope you understand my concern not only as a lawyer but as head of the office of the HEI. Now with the clarification, to me, I am assured now that maybe the way to go is to get the seal, which I just communicated in our chat group. Maybe it would delay a bit the process, but I am sure with CHED-DOH 3, alam ko mabilis naman sila magtrabaho. So to me, ang dating na lang po nito para wala namang masyado kaming complication sa magulang, sa estudyante, sa LGU at sa lahat, is we will proceed, but I would prefer to have the safety seal. Given the wording and the possible responsibilities, accountabilities that may attach to us in the implementation of what we perceive to be a policy guideline, but apparently it is rules and regulation in effect, and not just a guideline.
Yes, it is.
Thank you very much po. Thank you very much.
Yeah, precisely. That's why the safety seal is a certificate that says you did well, you are following the regulations, and there is no onus of negligence as far as you're concerned.
Thank you, sir.
Okay, Madam Chair. Attorney Barnes, thank you for raising your concern. So it's really noted. And indeed, it's the responsibility of the HEIs. After all, you are there. You are hands-on to your students. But nonetheless, makakaasa po kayo on the part of the CHED-DOH 3, yung mga mag-a-apply naman ng safety seal at your own option will be attended immediately by CHED-DOH 3. But then again, we would like to encourage all HEIs po, no? Kahit po yung tanong kanina ni Attorney Banyas kung ito ay nakalabas na at sinagot naman po ni Attorney Lito na ito ay dadaan pa po sa publication 15 days. But we are encouraging our HEIs na ihanda nyo na rin po. At tunay rin po yung sinabi naman ni Attorney Banyas na nagkaroon po tayo ng public hearing yon, Madam Attorney Banyas, to hear your voice. And thank you for recognizing that this guidelines is more detailed and more really comprehensive to guide our HEIs. Kasi narinig po namin yung boses ninyo at yung boses po ninyo ay naitala dito sa guidelines na ito para po kayo ay gabayan pa po at lalo ninyong maintindihan kung paano po madaling ma-implement ang ating limited face-to-face classes. Salamat, Attorney.
Okay, thank you, Attorney Simanya. And of course, we take note of the comments of Attorney Banyas. If I may just also manifest na, yun na nga, yun doon sa previous town hall sessions namin, we had conducted at least, I think, 3. Maybe you would notice that there were some changes now when we had our town hall sessions and the one that we are conducting now, the public orientation. We took into consideration the comments that we have raised during our town hall sessions, and that is why we incorporated the same in our guidelines now po. So that is the reason why there are some differences between the guidelines that we have issued during our town hall sessions and now during our public orientation. Okay, Ralph? Can we continue with yung other questions of our participants?
Okay po. Thank you very much to our TWG members and Attorney Banyas. Maraming salamat po. Next, we have from USM OSA, Director Yvonne. Ma'am.
Yes, magandang umaga po, sir. Sir, we have concerns from our students, particularly the required PhilHealth or its equivalent medical insurance. Many expressed that they could hardly pay the monthly premium of 300 pesos. And we've heard, though not yet so sure, na para mag-i-increase na naman daw po yata sila by next year. And our students, these students found difficulty in their online due to internet connection at saka yung load po nila. Thus, this would be another problem on the part of the students sustaining the payment of the monthly premium po. How about, sir, if we can appeal to the PhilHealth na magkaroon ng para special medical insurance for our students para ma-address po yung problema kasi mahirapan daw po sila sa monthly premium po ng PhilHealth, as this is a requirement for the face-to-face classes. Thank you very much po.
During, I think, in one of our town hall sessions, I think yung second yata namin or third town hall sessions namin, we also invited participants or resource persons from PhilHealth to clarify also the issue on contribution, what will be the amount, what is the process as to the registration. Let me just siguro echo what they have mentioned during our town hall sessions. If the student is less than 20, I think it's 20, if the student's 20 years old and below, ang registration po nila ay ano pa sila dependents pa sila ng kanilang mga parents. So kung dependents po sila ng kanilang mga parents, of course it is the parent who will register and who will pay the contribution. So they don't have to pay a separate. Hindi po kailangan. Kaya nga po nilagay po namin dyan sa aming guidelines na either as a I think contributor or yung dependent of their parent. So kung 20 years old ka and below and you are still a dependent of your parent, you don't need to register separately. Ibig sabihin, yung registration na po ng kanilang parent would suffice because they are considered as dependents of their parents. Okay, I think your concern is with respect to students who are 20, I think 21 and above. That they have to they have to register and pay the contribution. Doon po sa suggestion po ninyo that we coordinate with PhilHealth. We will raise that we have coordination naman with PhilHealth. We'll raise the concern that you have mentioned. Tingnan po natin kung ano po magiging sagot din po nila sa suggestion po natin.
Thank you very much, Ma'am Edie and Director Yvonne Sadili, for the question. Next, we have from our COCOPEA, sir, Chairperson of COCOPEA, Sir Anthony Tamayo. Good morning, sir.
Hello, can you hear me?
Yes, sir. Good morning, po.
Hi, ETCD and everyone. I just have a clarification from our PACU members who are asking me on behalf of the PACU members. They just wanted to expound on the on who pays the bills. So I understand that PhilHealth will be covering the bills or an insurance company that's hired. And we also share the concern that of those 18 and up, but I believe if you're registered, I think it's part of the universal health coverage. Our concern is who would be paying yearly. We wanted to see clarification. Who would pay any excess bills? That's our first questions. First question. And then the second question is, how would we know that the HEI is the cause of the transmission or the proximate cause and not, let's say, commuting? So from our PACU Viber group, these are the two questions that we're seeking clarification. So number one, who would pay the excess that is not covered by PhilHealth or the insurance? And then number two is, how do you prove that the HEI is the cause and not commuting or others? Thank you.
Yung sa first question, ang hirap ng mga questions ni PACU President Tamayo. But anyway, dun po sa first question, who will... But I know these are the usual concerns of our higher education institutions, of our students. One, let me just emphasize that this is the reason why you should have a communication plan also to your stakeholders, to your parents, to the parents of your students, to your students, because of course there are risks attendant to participating in the limited face-to-face classes. We have made the guidelines in such a way that, of course, priority pa rin natin is the health and safety of the students. That is why if they will opt not to participate in the limited face-to-face classes, they might do so because we understand that there are some students or there are some parents who still have concerns in the participation in the limited face-to-face classes. And in case they will participate, if they do not want to participate in the limited face-to-face classes, andyan pa rin po ang ating flexible learning, the online-offline modality. Ibig sabihin, ito po ay, kumbaga, we have made the guidelines in such a way na hindi ito burdensome on the part of the students, on the part of our higher education institutions as well, who will be implementing the same. To continue, kaya importante na may communication plan tayo sa mga students, sa mga ating mga stakeholders because there are risks attendant. Doon sa question po ninyo, who will shoulder in case may excess? Doon sa may excess po, we hope na of course kasi ano yan PhilHealth yung may coverage nung of course may maximum amount sila. Doon po sa remaining usually of course yung ano na talaga yung the person infected ang nag-shoulder, of course we hope that our higher education institutions will also help in facilitating, di ba, in coordinating with our local government units, kasi baka naman po pwede na doon sa mga quarantine nila, sa mga isolation rooms nila, doon na natin, tulungan din natin ang ating mga estudyante in case there will be infection para magkaroon po sila ng proper treatment. Doon po sa second question ninyo, how can you prove na there is that the COVID-19 is directly attributed to participation in the limited face-to-face classes? Of course, may ano naman po tayo, di ba? May standard of proofs naman po tayo na nire-require to determine if the sickness is attributed to yung certain ano talaga parang conditions or certain circumstance. Hindi ko masabi specifically ngayon because there are some scenarios na case-to-case basis po din ang treatment po sa kanya. So yung determination on whether the COVID-19, the infection to COVID-19 is attributed to participation in the limited face-to-face classes or doon po sa community, that is a case-to-case basis po. So walang one case scenario that may say directly na ito po ay attributed to the school, to the participation, to the participation in the limited face-to-face classes.
Okay, EDCD and everyone, thank you. Thank you for your reply. Thank you.
Thank you very much, President Anthony. Maraming salamat po from Cocope and Paku. Time check po, no? I think we will only be able to entertain a last question, but we have already taken note of your questions via the chat box and via Facebook Live, and we hope to answer them individually, no? And we will send the copy of the answers to the questions via your registered email. Now, for the last question from our Zoom room, we have from UNEP Attorney Remelisa Moraleda Alfa. Yes, ma'am. Good morning po. Yes, you can now unmute.
Okay, thank you very much. Good morning to everyone. I have actually 3 questions, no? I'll start with the easy ones. Okay, so actually it is practically, I think it was categorically mentioned that CHED doesn't want, parang hindi sila leaning towards testing, no? Kasi mako-complicate pa yung matters with regards to the students. And also, now that I have seen kumbaga ito na po yung final draft natin, ano? So this is already for implementation from my understanding, dahil orientation na nga ito. So medyo po hindi siya aligned with regards to the employees, no? Kasi doon po sa DOLE, IATF, sabi nila, employees who do not want to be vaccinated can still go to work as long as they have RT-PCR testing. But the JMC 2021-004 says that only vaccinated employees and faculty, non-teaching employees, can come inside the campus. So medyo maybe it can be expounded upon. Number 2 po, can we require face-to-face for, like for example, our clinical courses? Kasi it is also explicit in the JMC 2001-004 na parang hindi siya required, no? Yung face-to-face, it's still up to the HEI. So kung mag-require ng face-to-face ng HEI, nasa HEI yun. And at the same time, you also gave space for those who are not comfortable with face-to-face not to come to campus by giving them like opportunities for flexible learning, no, for distant remote learning. So okay naman yun sa amin, pero what if we require face-to-face for our clinical students? Can CHED support us on that, no? So that's my number 2. And my number 3 is actually again on the medical insurance. Actually, as yesterday po nagkaroon kami ng consultation with our faculty and deans, and then they told me that with regards to PhilHealth, pag government hospitals lang daw tinatanggap yung PhilHealth for COVID hospitalization. So there is parang we should because of the requirement for medical insurance, parang kailangan namin magbigay ng option to give like a private HMO insurance. Kasi right now yung insurance namin, it only covers accident insurance, no? So yung ordinary student insurance only covers accident insurance. Hindi covered yung COVID. So ang tanong ko, kung mag-additional fees ba kami, should we report this to CHED as additional increase of fees? Or do we have that space again that we can increase the fees? I mean, kahit at cost lang, kahit wala ng administrative cost na idadagdag kami, just so we can already start with the face-to-face. So yun lang po, 3 tanong. Thank you very much.
Thank you, Attorney Remelisa. Siguro I'll try to answer, tapos if the members of the technical working group can also join in the discussion. Okay, so first question po ninyo sa testing. Is there a standard time period for testing? The answer to that po is that we are basing our rules on actually the guidelines of the Department of Health. The Department of Health, during our discussion also with the representatives from the Department of Health, is that what they recognize is the symptomatic testing. Ibig sabihin, kung may symptoms, that's the time that you should that you should conduct testing. So yung mga mass swab testing po, testing is not required. As you can see in our guidelines, we are not requiring a mass testing of the students prior to their participation in the limited face-to-face classes. But in case there will be symptoms, then you can coordinate with your local government unit for symptomatic testing. As to yung question po ninyo, participation in the limited face-to-face classes of the teaching and non-teaching personnel. Actually, in our guidelines po, nakalagay po siya, hindi po yung enter the premises. We have, I think we have changed that. Initially, that is what is indicated in our guidelines, but we have changed that or amended that to participation in the limited face-to-face classes. Kasi yung participation in the limited face-to-face classes, ito po yung actual na pumupunta sa classroom together with the students. But they might, kumbaga, it will be within the prerogative na of the HEI, based on the DOLE rules and regulations, kung sino pwede pumasok sa kanilang mga offices. Yung DOLE rules na po ang magsasagot po dyan. But as to participation in the limited face-to-face classes, which is an actual interaction with the students, ito po yung nakalagay po sa guidelines namin na only fully vaccinated teaching and non-teaching personnel might participate in the limited face-to-face classes. Sa third question ni Attorney Remelisa on whether CHED may require in face-to-face classes of for internship components per program. Actually, ano po yan? The HCI may do so po. You can kumbaga, you can require a face-to-face classes for some of for the components or for some courses of your programs po. So yes, the answer to your question is yes po. Pwede po.
Okay,
Yes,
thank you very much.
Yes. But
Thank you
about
very
the
much.
medical insurance, yung medical
Yung
insurance,
ano po
yung
yung sa
magdadagdag.
medical insurance?
Additional fees,
Okay.
kami ng fees.
Okay,
Opo.
additional fees. Okay. Ang guidelines po namin sa increase in tuition fees, kung may increase in tuition fees, then you have to apply. If you will only realign, ibig sabihin, posible kasi na i-ano nyo lang po, diba? Parang some of the administrative fees now that you will not be using, for instance, sa athletic fees o kaya naman sa other fees, you might use it for other fees such as yung insurance, realigning lang po. I think ang rules namin is that you will just inform. Tama ba, Attorney Aliswag? Yung sa, I think yung Hdis ko nang sumagot tungkol dun sa realignment of fees.
You're right.
Po. Pero in case may increase, in case you will increase your tuition fee, then you will have to apply. Kung realignment, ano natin, Attorney Aliswag?
We allow that, especially under the bayanihan.
Inform lang tayo, di ba?
Yes,
You will just inform us. Our CHED-DOH. Okay.
And lagi namang may mga insurance na yung mga estudyante natin, di ba? In almost all the schools, they have their own insurance.
Yes po, but not for COVID. So generally po, mga ano lang yan, accident, mga liability insurance po, na parang third party liability insurance type na mga insurance po. Yan ang karamihan. Even the Red Cross, puro po yan accident. And maybe funeral, burial.
May advice, Panyera, is you start renegotiating your student health insurance.
Yes, opo. Thank you. Thank you po.
Thank you very much, Attorney Remelisa, Ma'am Cynthia, and Attorney Lito, and Dr. Simana. So that's it for our open forum. Unfortunately, we don't have any more time to answer all the other questions, but we have taken note of the same.
If I may,
yes,
Ralph,
Ma'am Cynthia.
okay, yung mga questions that we were not able to answer, as you can see, we have devised a frequently asked questions. So yung mga questions po namin, you can type it in our chat box. We will include it in our frequently asked questions so that even if you were not able to answer it now, we will be able to address pa rin po your concerns. As to yung question po doon sa PhilHealth, as to coverage, we will indicate that also in our frequently asked questions.
Yes.
Thank you very much, Ma'am Cindy. Thank you, Attorney Lito.
Happy New Year to all.
Happy New Year. So with that, here are some final reminders.
Ma'am Cindy, batiin natin sila ng Happy New Year, ma'am.
Thank you. Happy New Year po to all our HCI officials, employees, and staff. Actually, our responsibility to our stakeholders will start also, additional responsibilities natin will come in once we conduct our limited face-to-face classes. So I hope that all will be safe, especially once we have already started with our limited face-to-face classes. So sana po maging maayos po ang ating bagong taon. Maraming salamat po sa lahat ng mga nag-participate po ng ating public orientation.
Thank you very much, Attorney Lito, Attorney Cindy, Ma'am Simana. On that note, again, final reminders, a copy of the guidelines, presentation, and the frequently asked questions video will be sent to your registered email address after the event. Next, a copy of the guidelines may also be downloaded in the CHED website at the Issuances tab. So that's www.ched.gov.ph. So for further queries, clarifications, you may contact us through your respective CHED regional offices, or you may email us at limitedface-to-face@ched.gov.ph. Maraming salamat po sa inyong lahat for attending. And once again, Merry Christmas and a Happy New Year. Enjoy the holidays po. So with that, let's have a picture taking. So we have two panels. Okay, sige.
Huwag mo na mag-chat habang may picture taking. No chatting.
Yes, huwag mo na tayo mag-chat, no? Okay, let's prepare, no? Smile po tayo. 1, 2, 3, smile. All right, then another one, last one. 1, 2, 3. Smile. Okay, maraming salamat po. Magandang umaga po sa ating lahat. Enjoy your lunch.